Well, good afternoon, and thank you for joining us today for another Leadership Dialogue session. I'm John Haupert, President and CEO of Grady Health System in Atlanta, and also Board Chair of the American Hospital Association. I'm looking forward to our conversation today as we focus on the important role that hospitals and health systems play in leading medical research and innovation in order to transform patient care, making care better, more efficient, and accessible. Our guest today leads a health system that has made a significant commitment to innovation and research. Let me now introduce Bob Garrett, Chief Executive Officer of Hackensack Meridian Health, based in New Jersey. Hackensack Meridian is a truly comprehensive and integrated healthcare network comprised of 17 hospitals, including academic medical centers, children's, behavioral health, and rehabilitation hospitals. They have more than 36,000 team members and 7,000 physicians, providing care at more than 500 patient care locations throughout the state. Bob began serving as CEO of Hackensack University Health Network in 2009, was chosen to lead the newly founded network in 2016, and has since led Hackensack Meridian Health in opening the Center for Discovery and Innovation in 2019, drawing world-class scientists from institutions across the country with a special focus on infectious diseases and a wide variety of cancers. So please join me in welcoming Bob, and let's dive right into our conversation. So Bob, tell us about your commitment to innovation, when this journey began, and how your work has evolved into a true strategic priority.
Well, first off, thank you, John, for having me. It's a pleasure to be with you to discuss this important topic. And, when Hackensack Meridian Health was formed, our mission from the beginning was to transform healthcare. And we thought we couldn't do that unless we really focused on innovation. And within the broad umbrella of innovation, we felt that we needed to invest in and certainly grow our research capabilities. So it really started from the beginning of Hackensack Meridian Health's formation. And as you mentioned, we formed the Center for Discovery and Innovation in 2019. But preceding that, we certainly had a robust research infrastructure at Hackensack Meridian Health. And I think we had a real culture of innovation, and we encouraged innovation at the front lines of healthcare, as well as through partnerships with our scientific community and with startup organizations. So I do think that it was embedded in our culture from the beginning. It was consistent with our mission, and of course, with the formation of a research institute like the Center for Discovery and Innovation, it certainly moved the agenda forward in a great deal.
Great, thank you for that. Secondly, would you offer your thoughts on the value or opportunity for hospitals and health systems to be leaders in health innovation? How can our environment naturally accelerate research to address the most urgent clinical need facing our patients, and then hopefully translate them into therapies or interventions?
Yeah, so I think a great example, John, of that is the formation of our Center for Discovery and Innovation. It was founded with the premise that research and discovery shouldn't be waiting for years to have application on the front lines or in the clinical settings. The idea was to translate what's going on in the scientific laboratories to the frontline caregivers, to our care sites as quickly as possible. So one thing that we did in terms of a structure is we embedded the Center for Discovery and Innovation within the Hackensack Meridian Health Network. So it wasn't in any separate entity. It wasn't in a so-called ivory tower. It was really embedded right within the four walls, if you will, of the clinical enterprise, Hackensack Meridian Health. And that was done purposefully because we felt that by making it a part of our total enterprise, there would be more interaction between the scientists and the clinicians so that we could translate what was happening in the laboratories to the bedside quicker. And in fact, that really did happen. And, just give you, a couple of examples. So first of all, since it was founded in 2019, it's been incredible growth. We've grown from 20 to 180 scientists, from 4 laboratories to 27 laboratories. We have 58 NIH grants right now that we're managing. We have 2 NIH Centers of Excellence within the Center for Discovery and Innovation. Our total research grant funding has expanded by leaps and bounds, and last year it was over $113 million, not even including a special NIH grant that we received to develop new drugs to fight variants of COVID and other global threats for the future. So there's been tremendous growth, but a couple examples, and I'll give them, during the COVID era that were, in my view, just game changers. The Center for Discovery and Innovation, very early on, with the collaboration of both the pharmaceutical industry and with the clinicians on the front lines at Hackensack Meridian Health, was able to develop a commercial test to identify COVID in a rapid manner. Within 1 week of the pandemic hitting, the turnaround time for diagnosing somebody with COVID went literally from weeks, and even, you could say, even over a month at the very, very beginning, to a matter of hours. And that was really a concerted effort and an effort of collaboration that led to that breakthrough. Early on in the pandemic, working with clinicians in our cancer center, the scientists at the Center for Discovery and Innovation put together a convalescent plasma therapy clinical trial, which proved to be much more effective than some of the national trials that were being established at the same time, and really was another game changer that saved countless number of lives early on in the pandemic. Through collaborations with pharmaceutical companies, they were able at the CDI to develop a tracker so that we're tracking in real time variants of COVID. We're working closely with our own Department of Health and with the CDC on that. A couple other examples outside of the COVID realm, John, are in, I would say, in behavioral health. There's been a real focus in the Center for Discovery and Innovation in behavioral health. That's because Hackensack Meridian Health has made behavioral health a strategic priority to address. So another advantage of working within a health system for a research institute like that is they will mirror what the strategic and clinical priorities are for the health system and really focus their research in behavioral health. And they have developed some exciting new technologies that will help us both diagnose and treat patients that have behavioral health disorders or mental health illnesses. So another good example there would be population health. Another focus for our health system, the Center for Discovery and Innovation, as a result of it being the HMH's priority, did put a focus on population health. And as a result of their focus, it led us to a new screening tool where we're out there screening literally, I think it's up to 700,000 patients now in the last year and a half that might be of high risk for one or more of the social determinants of health. And then we in turn then refer those patients to get help. That was a result of a collaboration with the Center for Discovery and Innovation as well. So there's great examples within the health system. So the two takeaways I would leave you with on that question would be, number one, embedding that the research institute within the health system leads to better collaboration, better coordination, and it also enables that research institute to mirror the healthcare priorities that the health system has identified as being the top focused strategic priorities.
Well, Bob, that's incredibly amazing growth over that period of time. And personally, I want to thank you for the focus you've placed, number one, on behavioral health, number two, on addressing and identifying social determinants, and then third, making a commitment to expedite research into translation so that it can get to the bedside even faster. Very impressive work, very admirable work, so thank you. Let's talk now about any partnerships or collaborations with other organizations or scientific leaders that have formed through your research efforts. And how does that benefit your patients and community?
Yeah, so that's a great question, John. And there are some good examples of collaborations and partnerships. Let me start with a couple on the pharmaceutical side. So we have established a major partnership with Merck, where we have an antiviral drug development program. That certainly was very helpful in the early stages of COVID as well. But we're also looking at not only infectious diseases, but looking at new cancer therapies that we're partnered with Merck on. Pfizer was an early partnership as well, and as a result of Pfizer actually set up a major laboratory at our Center for Discovery and Innovation, and some of the major research that led to the breakthroughs in terms of the vaccine did occur on our campus and in collaboration with our Center for Discovery and Innovation. And we're excited about building off of that partnership with Pfizer to develop new vaccines and additional therapeutics as well. We also have some major partnerships with companies like Regeneron, with Quest Diagnostics, with BD on the research side as well. So, I think the pharmaceutical partnerships are helpful in a lot of ways. It certainly leads to quicker discovery. It also focuses the research, again, bringing clinicians into the picture, focuses the research on where clinicians think the research will make the biggest difference. So I really do advocate for those close partnerships. On the non-pharmaceutical side, we also have partnerships with organizations like Memorial Sloan Kettering Cancer Center, where we've developed clinical trials together with MSK, and that's been very exciting. The partnership now goes back over 5 years. Some of the partnership is involved on clinical sites and coordinating care between outpatient and inpatient cancer care. But these clinical trials, which are so important in delivering cancer care, because over 50% of our cancer patients are now on clinical trials, I think that partnership has really made a huge difference. In addition to that, we through our cancer center, we have an NCI designation in partnership with Georgetown Lombardi Cancer Center. So our scientists collaborate very closely with the researchers and scientists down at Georgetown University, and as part of that cancer collaboration. So I think these collaborations, these partnerships, only lead to quicker discovery, and again, more focused on the real problems and issues that we're facing in healthcare today.
Yeah, I absolutely agree with you about the level of collaboration expediting findings and getting those to the community. So, of course, you know that not every hospital or health system will be able to engage in that level of innovation, the level you all have achieved. But everyone can do something. So, what benefits have you seen, whether that be on culture, patient outcomes, or community benefits that others could be focused upon and/or achieve? And what obstacles and or lessons learned can you share?
Yeah, I think that's a really important question because, healthcare is challenged these days, financially, and it might be difficult for health systems and hospitals to make investments in innovation and research and discovery. But I think there are significant benefits that can accrue. The other thing I would say is that, John, that our CDI, our Center for Discovery and Innovation, was founded also with some key business principles, which basically were that research doesn't necessarily have to lose money and be an economic drain. If the focus is in the right place, maybe through partnerships, whether it's through governmental partnerships or private funding of research, in addition to looking for avenues or opportunities for commercialization to bring in additional revenue streams. I think the premise, at least at Hackensack Meridian, was that we wanted to at least break even with our research endeavor. And we hired a chief scientific officer, Dr. David Perlin, who had that philosophy as well. So he was, a world-renowned infectious disease researcher, but also I have to say has significant business acumen, and came in really with that principle that he did not want this to be necessarily a financial drain on the health system. Having said that, I think there are ways to invest in research that maybe it is not costly and will bring some community benefit right away. I mentioned before, in the area of health equity, there is research that can be done in population health and in health equity that might not require big capital commitment, but can really pay dividends in improving the overall health status of the communities that we serve, but also in reducing some of those disparities that we see, particularly in underserved areas as we look at health outcomes. And the example I gave earlier about the social determinants of health and the Unite Us digital platform that we're using as a result of the research that was done by our research team, I think is a good example there. But I do believe that as part of our mission to really make sure we provide value to our communities, we have a responsibility to continue to innovate, to continue to do some research. And the innovation might be a little bit outside of the laboratories themselves, John. We see certainly remote virtual care as an innovation that can really help our communities significantly. That might require a different type of investment. Certainly, some of those principles can be tested within a research institute. But I do think if research is embedded in your culture, I think there are great opportunities to improve the communities that you serve and the health of those communities by thinking innovatively.
Well said, very well said. So let's circle back around to the point you made about a basic principle being not to lose money, but to break even on these endeavors. AHA has been ringing the alarm about the financial pressures that the field has been facing. As we advocate for the financial sustainability of hospitals, tell us what implications this might have on your ability to sustain your research and innovation efforts.
Well, I do think it gets more and more challenging, but from a financial perspective, because Hackensack Meridian is certainly not immune to what's happening out in the healthcare sector, it's a very, very challenging time financially for hospitals and health systems coming out of COVID. Having said that, though, if we're going to succeed in the future, as I mentioned before, innovation is going to be very, very key for healthcare systems and hospitals to really deliver on the promise that they make to the community. So I would advocate for that to be a piece of the messaging that goes into to our stakeholders, and that investments in research, investments in innovation are going to be essential, really, to improve the health of our communities and to face challenges head on, like health inequities that exist today. Again, I don't believe we're going to be able to transform healthcare if we don't address these issues. So I think it's an important message to send to Washington and to our state capitals, wherever possible, that this is that if the funding isn't there for hospitals and health systems, many of the innovation that's going on now and some of that research and discovery really would be at risk, which means that our communities will be at risk.
Yeah, absolutely. So lastly, as we wrap up our conversation today, tell us a little bit about what's next. Any specific clinical areas or population health challenges you'll be focusing on?
Well, I think we're going to continue to look at behavioral health, particularly in terms of innovation that can improve access. We know there's a shortage of behavioral health specialists, starting with psychiatrists. So I think there's more that's going to be needed to invest in virtual healthcare. I do believe that's going to be important in terms of reaching people so that we can make a diagnosis and then we can hopefully treat patients again by telepsychiatry, by remote means. I think another area of virtual care that we're focused on is virtual nursing care. With the shortage, the workforce shortages that go on, and with the particular shortage of nurses that we see today, and that I think are going to get just worse. I just saw a statistic the other day that I believe 1 out of 3 RNs across the country are seriously considering leaving the profession within the next 18 months, which is pretty scary given all the nurses who have already left the profession since the start of the COVID pandemic. I think virtual nursing is, or remote nursing, as many call it, is a potential solution, not the only solution, but a solution. So certainly we're going to do a little bit more research there. We're currently doing a pilot with a company called Banyan Health at one of our hospitals, and it's showing some promise where the virtual nurses are actually assisting those nurses that are at the bedside with some of the tasks maybe that are keeping those bedside nurses away from direct patient care. So if that pilot's successful, we would love to roll that out and deploy it throughout our network. But I think, in terms of what's next, I think certainly, virtual care is going to be a big piece of what's next. And the last piece, while I'm talking about virtual care, is a hospital at home. I do believe that there's certainly more research that needs to be done in that regard. But I do believe that is going to be the future. We are currently participating in some of the federal hospital at home programs, and we're looking to potentially strike up a national partnership that will enable us to really become a major player in the hospital at home market. I think it's something that consumers are ultimately going to want. I think it's still a challenge in convincing providers that it's 100% safe, but I think it is something that shows a lot of promise, and I think that is also a major initiative that's next on the agenda.
And Hospital at Home is very much an initiative for which the AHA is advocating for continued funding as we move out of the public health emergency. So Bob, thank you again for joining me. You're clearly doing some exciting and incredible work, and I appreciate you sharing some of that with us today. It is important to recognize both the important contribution and also opportunities for hospitals and health systems to be leaders of innovation and scientific research. Thank you all for joining today, and I hope you'll be back for next month's Leadership Dialogue.